Good morning. My name is Dr. Ali Bernard Khalil. I'm a consultant endocrinologist and head division of endocrinology at Reem Hospital. Today's topic will focus on the advancement in the management of thyroid nodules. As you know, thyroid nodules, 95% of them are benign in nature. Only 5% of them are cancerous and of concern to the patient. Of those 95% nodules, some of them sometimes they take a growth that really is out of range, causing local discomfort and difficulty swallowing or breathing. The option for treatment in those cases is either surgery or now what we call, if really surgery is not an option because of the medical condition that the patient is having or because of cosmetic reasons, we can resort to what we call non-invasive type of modalities for the treatment of those large nodules causing local discomfort. If the nodule is cystic, which means it has mainly made of fluid inside the nodule, we can resort to what we call a needle aspiration of the liquid that's inside the nodule, followed by ethanol injection, which is a substance that causes sclerosis within the nodule and resulting in the shrinkage of the size and size reduction. Other modalities, we call them thermal ablation of thyroid nodule, and there are different modalities. Some of them use ultrasound, and we call them, it's called HIFI, with HIFA, which means using high frequency ultrasound focused waves to cause local heat, and then the heat causes necrosis and coagulation, resulting in the shrinkage, secondary shrinkage of the thyroid nodule. Others use electromagnetic waves such as microwaves or radio frequency. The difference between them is the difference in the number of the frequency of the waves that is used. The principle is the same. Basically, the radio frequency, for instance, this is the one that we currently are using at Reem Hospital, will cause increased temperature, and the increased temperature will lead to increased ionic vibration, which when the temperature is 60 degrees, that will cause coagulation of the tissue and secondary necrosis. And the end point is the tissue, viable tissue within the nodule will die, and which result with time, and we estimate between 3 to 6 months, there will be between 50 and 80% reduction in the volume of the nodule. So this is a new modality, is a non-invasive. When we compare it to surgery, is associated with less complication. As you know, surgery can result in in underactive thyroid, and the patient has to resort to medical therapy for all their life, and with all the complications related to intake of additional thyroid medication, they can lead to nerve damage, local bleeding. Those we see them with thermal ablation, but most of those are reversible causes, whereas with surgery that could be a little bit more damaging. With the incision in the front of the neck seen with surgery, which is not the case with thermal ablation, there is no evidence. Initially, there is maybe some local hematoma or bruising that resolved within 1 month to 2 months' time. So it's well tolerated, minimal complications, and very well accepted by the patients. Thank you very much. Looking forward to provide this kind of service. We are available for any further questions at Reem Hospital.